A client with gastroenteritis has an as-needed prescription for loperamide hydrochloride. For which condition would the nurse administer this medication? 1. Constipation. 2. Abdominal pain. 3. An episode of diarrhea. 4. Hematest positive nasogastric tube drainage. A client with a gastric ulcer has a prescription for sucralfate 1 gram by mouth 4 times daily. The nurse would schedule the medication for which times? 1. With meals and at bedtime. 2. Every 6 hours around the clock. 3. 1 hour after meals and at bedtime. 4. 1 hour before meals and at bedtime. The emergency department nurse is assessing a client who has sustained a blunt injury to the chest wall. Which finding indicates the presence of a pneumothorax in this client? 1. A low respiratory rate. 2. Diminished breath sounds. 3. The presence of a barrel chest. 4. A sucking sound at the site of injury. The nurse is assessing the respiratory status of a client who has suffered a fractured rib. The nurse would expect to note which finding? 1. Slow, deep respirations. 2. Rapid, deep respirations. 3. Paradoxical respirations. 4. Pain, especially with inspiration. The nurse is assessing a client with multiple trauma who is at risk for developing acute respiratory distress syndrome. The nurse would assess for which earliest sign of acute respiratory distress syndrome? 1. Bilateral wheezing. 2. Inspiratory crackles. 3. Intercostal retractions. 4. Increased respiratory rate. A client has experienced pulmonary embolism. The nurse would assess for which symptom, which is most commonly reported. 1. Hot, flushed feeling. 2. Sudden chills and fever. 3. Chest pain that occurs suddenly. 4. Dyspnea when deep breaths are taken. A client who is human immunodeficiency virus, HIV, positive has had a tuberculin skin test. The nurse notes a 7 area of induration at the site of the skin test and interprets the result as which? Finding. 1. Positive. 2. Negative. 3. Inconclusive. 4. Need for repeat testing. The nurse performs an admission assessment on a client with a diagnosis of tuberculosis. The nurse would check the results of which diagnostic test that will confirm this diagnosis? 1. Chest X-ray. 2. Bronchoscope. 3. Sputum culture. 4. Tuberculin skin test. A client with a chest injury has suffered fail chest. The nurse assesses the client for which most distinctive sign of fail chest? 1. Cyanosis. 2. Hypotension. 3. Paradoxical chest movement. 4. Dyspnea, especially on exhalation. A nurse is completing the 1-minute Upgar assessment on a full-term newborn. The heart rate is 80 beats per minute. In response to this assessment, the nurse should 1. Document a 2 for the heart rate parameter of the Upgar score. 2. Document a 0 for the heart rate parameter of the Upgar score. 3. Continue to evaluate the rest of the Upgar scoring parameters before determining a heart rate score. 4. Begin immediate positive pressure ventilation. While assessing an 8-hour-old newborn, a nurse finds an axillary temperature of 97 degrees Fahrenheit. In response to this finding, the nurse's first intervention should be to 1. Document the findings. 2. Place the infant under a radiant warmer. 3. Feed the infant warmed formula. 4. Call the health care provider to report the findings. During the assessment of a full-term newborn infant who is 40 hours old, a nurse evaluates the infant for jaundice by 1. Removing the diaper and assessing the color of the genitalia. 2. Applying pressure on the forehead for a few seconds and evaluating the skin color after the pressure is removed. 3. Assessing the color of the palms of the hands and comparing that skin color to the color of the soles of the feet. Which findings should the nurse anticipate when assessing a client newly diagnosed with diabetes insipidus? 1. Polyuria. 2. Weight gain. 3. Hyperglycemia. 4. Profuse sweating and flushed skin. The serum ammonia level of a client with cirrhosis is elevated. As a priority, a nurse should plan to 1. Monitor the client's temperature every 4 hours. 2. Observe for increasing confusion. 3. Measure the urine-specific gravity. 4. Restrict the client's oral fluid intake. A nurse suspects that a client, admitted with upper right-sided abdominal pain, may have liver cancer when which serum laboratory test result is noted TOB elevated. 1. Creatinine. 2. Serum phytoprotein AFP levels. 3. Serum phosphorus levels. 4. CA-125. A nurse is assessing a client with a diagnosed inguinal hernia at a scheduled clinic visit. The nurse suspects that the client's hernia may be strangulated when which finding is noted on assessment. 1. Shortness of breath. 2. Intense abdominal pain. 3. Constipation. 4. Hyperactive bowel sounds. A nurse is assessing a client diagnosed with acute diverticulitis. Which finding should make the nurse suspect that the client has an intestinal perforation? 1. Elevated white blood cells WBCS. 2. Temperature of 101 degrees Fahrenheit. 3. Absent bowel sounds. 4. Abdominal pain. A client who has received 50 milliliters of a unit of whole blood complains of low back pain. In response to this client's symptom, a nurse should first 1. Reposition the client. 2. Assess the pain further. 3. Administer an analgesic. 4. Stop the blood transfusion. A female nurse tells a coworker that she is confused because a physician stated that graft versus host disease, GVHD, symptoms were desirable for a particular client after a bone marrow transplant. In which type of malignancy is GVHD sometimes desirable? 1. Gastrointestinal. 2. Reproductive. 3. Neurological. 4. Hematological. A client presents with a meningioma and symptoms of increased intracranial pressure. Which manifestations should a nurse least expect to find on assessment of this client? 1. Headache. 2. Vomiting. 3. Pyrexia. 4. Papilledema.